Bonjour et bienvenue à cette conférence de presse.
Good morning and welcome to this press
Good
conference.
morning, good afternoon, and welcome to this press conference. Je vais maintenant passer la parole au ministre
I will now
LeBlanc
give the floor to Minister LeBlanc to begin.
Alors, merci beaucoup,
Thank
Jean-Sébastien.
you very much,
Good afternoon, everybody.
Jean-Sébastien.
Today, I'm joined by Dr. Njoo, Brigadier General Brodie, and Madame Paquette from Public Services and Procurement Canada. So we'll begin right away with Dr. Njoo. À vous, le Dr. Njoo.
Over to you, Dr. Njoo.
Merci, Ministre LeBlanc.
Thank you, Minister
Bonjour à
LeBlanc.
toutes et à tous.
Good morning
Disease
to
activity
everyone.
and severity trends remain at much reduced levels in most jurisdictions across Canada. Total active cases are now below 4,700 for the first time since late August last summer. And there are 400 new cases being reported daily. Severity trends continue to decline, with 87% fewer people in hospitals with COVID-19 daily than the peak of the third wave, and an average of 9 deaths are being reported daily. To date, over 45 million doses of COVID-19 vaccines have been given in Canada, which equates to over 26.5 million, or 80% of eligible people aged 12 years or older in Canada with at least one dose. The proportion of eligible people who are now fully vaccinated is now over 57% and steadily increasing, with many more people registered or intending to get vaccinated. The latest Canadian data from June tells us that 84 to 88% of those surveyed have either received a dose of COVID-19 vaccine already or intend to get one soon. This is great news because the more people who get vaccinated, the stronger our vaccination firewall will be for all our benefit. When we say every vaccination counts, it applies to all eligible ages in all areas of the country, as well as to people who have had a previous COVID-19 infection. That's because any gaps in protection for you as an individual or for Canadians collectively is a weakness in the firewall where the virus can get in and spread. And there is a lot to protect inside the firewall, from your health to the health and well-being of all those who can't get vaccinated, such as young children and those with medical contraindications to the vaccines. With 7 weeks to go before the fall and back to school, college, and university, there's just enough time to turn our best intentions into reality and readiness. COVID-19 vaccination is important for everyone, including younger age groups, how important they are in the vaccination effort. So if you haven't already, please make an appointment to get your first or second dose as soon as you are able. If you have questions or concerns, please reach out to a trusted source such as your healthcare provider or local public health authority, or visit canada.ca for comprehensive information on COVID-19 vaccines. Canadians are reminded that it is safe to receive one vaccine product for your first dose and a different vaccine product for your second dose. Likewise, Canada's National Advisory Committee on Immunization, or NACI, considers the mRNA COVID-19 vaccines, Pfizer and Moderna, to be interchangeable. That means if the same mRNA vaccine you received for your first dose is not readily available at your clinic, it is safe to receive another mRNA vaccine so you can complete your 2-dose vaccine series as soon as you're eligible. Bonjour à toutes et à tous. Les taux de transmission de la maladie et les tendances sur le front de nombre de cas graves maintiennent à des niveaux très réduits dans la plupart des endroits au Canada. Le nombre total de cas actifs est maintenant inférieur de 4 700 pour la première fois depuis la fin du mois d'août l'été dernier. Et 400 nouveaux cas
and there are
sont
400
signalés
new
chaque jour.
cases being reported
La tendance à la
daily.
diminution du nombre de
Severity
cas graves
trends
de la
continue to
maladie se poursuit.
decline,
On compte 87%
with
moins de personnes
87%
atteintes
fewer
de la
people in
COVID-19
hospitals
dans
with
les hôpitaux par rapport
COVID-19
avec
daily
le pic de la
than the
troisième
peak of the
vague,
third
et en
wave,
moyenne 9 décès
and an
sont
average of
signalés
9
chaque
deaths
jour.
are being reported
À ce jour,
daily.
plus de
To date,
45 millions de
over
doses de vaccins
45
contre
million
la
doses of
COVID-19 ont
COVID-19
été
vaccines
administrés au
have been
Canada,
given in
ce qui
Canada,
signifie que plus de
which equates
26,5
to
millions de
over
personnes, soit
26.5
80% des
million,
personnes
or
admissibles
almost
âgées
80%
de
of
12 ans ou
eligible
plus
people
ont reçu
aged
au
12
moins
years or
une
older
dose.
in
La
Canada with at
proportion de
least
personnes
one dose.
admissibles
The proportion of eligible people who are now fully vaccinated is now over 57% and steadily increasing, with many more people registered or intending to get vaccinated. The latest Canadian data from June tells us that 84 to 88% of those surveyed have either received a dose of COVID-19 vaccine already or intend to get one soon. This is great news because the more people who get vaccinated, the stronger our vaccination firewall will be for the benefit of all of us. When we say every vaccination counts, it applies to all eligible ages in all areas of the country, as well as to people who have had a previous COVID-19 infection. That's because any gaps in protection for you as an individual or for Canadians collectively is a weakness in the firewall where the virus can get in and spread. And there is a lot to protect inside the firewall, from your health to the health and well-being of all those who cannot get vaccinated, such as young children, or those with medical contraindications to the vaccines. With 7 weeks to go before the fall and back to school, college, and university, there's just enough time to turn our best intentions into reality and readiness. COVID-19 vaccination is important for all eligible age groups. So in this latest reminder, for the call to arms, I want everyone, including younger eligible age groups, to know how important they are in the vaccination effort. If you haven't done so already, please make an appointment to get your first or second dose as soon as you're able to. If you have any questions or concerns, please reach out to a trusted source, such as your healthcare provider or local public health authority, or visit Canada.ca for comprehensive information on COVID-19 vaccines. We would like to remind Canadians that it is safe to receive one vaccine product for your first dose and a different vaccine product for your second dose. Likewise, Canada's National Advisory Committee on Immunization considers the mRNA COVID-19 vaccines Pfizer and Moderna to be interchangeable. That means if the same mRNA vaccine you received for your first dose is not readily available at your clinic, it's safe to receive another mRNA vaccine so you can complete your two-dose vaccine series as soon as you're eligible.
Thank you.
Miigwech.
Thank you very much, Dr. Njoo, and we'll now turn to Brigadier General Brodie. So over to you, General.
Thank you, Minister. This week, we are bringing in 7.1 million doses of COVID-19 vaccines, including 4 million Moderna and 3.1 million doses of Pfizer-BioNTech. By Friday, we anticipate 63 million doses in Canada. We expect to cross the 66 million threshold next week, which will signal that there are sufficient doses in country to vaccinate every currently eligible Canadian. But it is important to note that our domestic vaccine requirements do not end there. Canada will need continuing access to vaccines for newly eligible populations and for additional doses over time as the virus evolves. We also need the flexibility to pivot doses to support our donation efforts. With this in mind, we are managing Canada's COVID-19 vaccine supply strategically to ensure vaccines are stewarded to best support Canada's evolving domestic needs and optimize ways to support global vaccination efforts. Canada's strategic vaccine supply is the framework by which we balance our national vaccine portfolio. It includes vaccines produced and provided direct from manufacturers based on Canada's procurement agreements, and doses that are shipped to federal, provincial, and territorial jurisdictions to support the immediate needs of immunization programs. It also includes doses in central inventory allocated to the jurisdictions but held at their request, as well as a small, carefully curated supply to provide an operational buffer for urgent demands. Canada's strategic vaccines supply provides the system and mechanisms to bring in new vaccines as formulations and eligible populations evolve in the coming months, and to route vaccines to where they are needed most, at home and internationally. We continue to closely coordinate with stakeholders and partners to best align supply with demand as we seek to maximize vaccination rates and protect as many people as possible as quickly as possible. Cette semaine, nous apportons 7,1 millions de doses de vaccins contre la COVID-19.
This week, we're bringing in 7.1 million doses of COVID-19 vaccines,
4 millions de Moderna,
including 4 million Moderna and 3.1 million doses of Pfizer-BioNTech.
Nous anticipons
By Friday,
près de 63
we
millions de doses au
anticipate
Canada.
having received 63 million doses in Canada, and we expect to cross the 66 million threshold next week, which will signal that there are sufficient doses in country to vaccinate every currently eligible Canadian. But it's important to note that our domestic vaccine requirements do not end there. Canada will need continuing access to vaccines for newly eligible populations and for additional doses over time as the virus evolves. We also need the flexibility to pivot doses to support our donation efforts. With this in mind, we are managing Canada's COVID-19 vaccine supply strategically to ensure vaccines are stewarded to the best, rather to best support Canada's evolving domestic needs and optimize ways to support global vaccination efforts. Canada's strategic vaccine supply is the framework whereby we will balance our national vaccine portfolio. These vaccines are produced and provided directly from manufacturers based on Canada's procurement agreements, and doses are shipped to federal, provincial, and territorial jurisdictions to support the immediate needs of immunization programs. It also includes doses in a central inventory allocated to the jurisdictions but held at their request, as well as a small, carefully curated supply to provide an operational buffer for urgent demands. Canada's strategic vaccine supply provides the system and mechanisms to bring in new vaccines as formulations and eligible populations evolve in the coming months, and to route vaccines to where they are needed the most, both at home and abroad. We will continue to closely coordinate with stakeholders and partners to best align supply with demand as we seek to maximize vaccination rates and protect as many people as possible as quickly as possible. Thank you. Miigwech.
Thank you very much, General Brodie. Alors, Jean-Sébastien, à vous maintenant pour les questions.
To you for questions.
Merci beaucoup, Monsieur le Ministre.
Thank you very much, Mr. Minister. So we will now begin the question
Ministers, the Brigadier
and
General
answer
and Dr. Njoo,
period.
I'll be happy to take your questions. As usual, it will be one question and one follow-up. Donc, comme d'habitude, ça va être une question et un suivi.
As usual, one question and one follow-up per journalist.
Question. Donc, je vais maintenant passer la parole à l'opératrice Kate pour la
Now,
première
over
question.
to the operator, Kate.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, la première question. Jacques Galland, Toronto Star, your line is open. À vous la parole.
Hi, good morning. My questions are about the border, and I suppose for Minister LeBlanc or Dr. Njoo. With regards to fully vaccinated travelers, I'm wondering, could you explain why the government decided to keep the requirement for the pre-arrival test but is removing the requirement for the on-arrival test and replacing that with random testing. Just because I note that the Health Canada expert panel on testing and quarantine had actually recommended doing away with the pre-arrival test, but keeping the on-arrival test. And a number of experts since yesterday have also expressed concern that removing the on-arrival test makes Canada vulnerable to potential new variants in the fall. So I'm wondering if you could provide some justification for those changes. Thanks.
Hi, it's Dominic LeBlanc. I'll offer a few comments, but I think Dr. Njoo is also well placed to offer some of the scientific and public health rationale for those measures. The government has said from the beginning of the pandemic that we would evolve measures at the border, including adding, as you'll remember, last fall or during the winter, increased levels of protection for Canadians. And we also said when it's safe to do so, we would look at measures that could be relaxed while at the same time and all the while maintaining the necessary protection for Canadians. That's why the government started initially with opening the border to fully vaccinated visitors from the United States, and later in September, as you know, opening the border to visitors from other countries, but also fully vaccinated people. I think Dr. Tam and Dr. Njoo have said in a number of press conferences over many weeks that the importance of having an arrival test, whether it's a random arrival test for those who are fully vaccinated or an obligatory test for those that aren't, is one of the essential elements in tracking data on whether vaccinated people can in fact carry the virus, or obviously looking at having reliable and accurate data with respect to potential variants of concern. But in terms of the scientific reason why a pre-arrival test was preferred as opposed to an on-arrival test, perhaps Dr. Njoo, you could add something.
Okay, well, thank you very much, Minister LeBlanc. What I would say, first of all, with respect to vaccination, because we're talking about fully vaccinated travelers, I think I said before is that it's a question of what I would call a reasonable risk management. So, as we know in Canada, a major part of the reason why we're opening up our borders in a very sort of slow and stepwise fashion is because the Canadian population is now quite highly vaccinated, and certainly I think we could still do better. But we have a more resilient population in terms of protection at a population level against COVID-19. So 80% with one dose, tracking towards 60% for two doses. I think we could do better, and we should go for 90% plus. I think for double vaccination coverage, so that we have a more resilient population. Now to the question of who we should let into the country. As we know, certainly fully vaccinated travelers, if they have adequate proof, certainly would pose, I would say, a much reduced risk in terms of both importation and then even further transmission of the virus once they enter Canada. The reason for the pre-departure test is that we know that no vaccine's perfect, and also that the test, I think, gives us at least that level of assurance that should someone show up before they even get to Canada with a positive test, and obviously they shouldn't be allowed to, let's say in this case, board a plane and then come to Canada. Coming to Canada, certainly what we've done is we've followed the data, and the data we've seen in both sort of land and air travel arrivals has shown that in terms of the arrival test results, an extremely low percentage, and it's been dropping over time, have actually come up with a positive test result. The last figures I've seen are sort of like fractions below 1% for both the air and land travel. So as sort of a risk mitigation, I think that it's reasonable this time as we continue to follow the science that we still keep the pre-departure test in place. So that's the level of assurance in terms of travelers not coming to Canada already carrying COVID-19. But once they come here and they have that sort of a negative pre-departure test before coming to Canada, then in terms of their actual risk of still somehow having COVID-19 and then passing it on, I think is much reduced. The testing results bear that out to date with the experience we've had so far. And as well, we know certainly from the evidence around the world, fully vaccinated individuals, although there's always that chance, it's much lower in terms of actually having COVID-19 and then also possibly transmitting it to others. So that's the rationale behind that. But we'll continue to follow the data, and if we need to make adjustments in the future based on what the epidemiology and the data shows, we'll do that.
Great, thanks. And my follow-up is again on the border, and it again points to recommendations from that expert panel's report, and it has to do with partially vaccinated and unvaccinated travelers. They had recommended shorter quarantine periods for those individuals in line with the testing protocol. I think for partially vaccinated, it was if they test negative with their on-arrival test, they can be let out of quarantine, and unvaccinated could be let out of quarantine if their day 7 test is negative. So I'm also just wondering why the government is still insisting on a 14-day quarantine period for those individuals.
There again, I think obviously respect the considered opinions or recommendations, like you say, from the testing panel. There's a lot of science and evidence that continues to grow every day, and I think at any given point in time, experts can look at data and make their best recommendations based on the data that's available at that point in time. What I would say is that again, it's a question of what we might call reasonable risk management. Everyone, I think, is of the same mind that in terms of the incubation period. The outer limit, certainly from what we've seen around the world and here in Canada, is 14 days, meaning that if someone's actually exposed to the virus, it can take up to 14 days for that person to develop symptoms and then obviously be infectious to others. But obviously, it's not equally distributed, and the vast majority of individuals certainly develop symptoms in terms of their incubation period well before the 14 days, 3, 4, 5, up to 7, 8 days. And that's where the bulk of individuals who actually have COVID-19 would be expected to develop symptoms. So I guess to the testing panel's point, the incremental benefit in terms of someone being let out, let's say at a shorter period of time, not the full 14 days, yes, you would still capture most of the people that would actually have COVID-19 based on sort of what we know about incubation period, in terms of the vast majority of people developing symptoms. But you would miss a certain percentage. And so the incremental increase in terms of the safety and security by having it up to the full 14 days, let's say for a quarantine, that obviously is something that's considered by the decision makers. And so I think in terms of being very, I would say, conservative, prudent in terms of protecting the health and security of Canadians, that's how the government sort of continues or lands on the 14 days at this point. Like I say, the science continues to evolve, and there's certainly I think nothing's ever carved in stone, and down the road there could be modifications as appropriate, guided by the science.
Thank you, Dr. Njoo. And operator, over to you for the next question. Donc, à vous pour la prochaine question.
Thank you. Merci. Our next question. La prochaine question. Louis Blouin, Radio-Canada. Your line is open. À vous la parole.
Bonjour, une question pour
yes, hello, a question for Dr. Njoo. This morning, Canada's Prime Minister took part in a public event in Ontario outside, and he was surrounded by dozens of people. In fact, he was in a crowd. The Prime Minister was wearing a mask, but a lot of people around him were not wearing a mask, and physical distancing guidelines were not respected. As well, the NDP leader was also shaking hands, taking pictures in a crowd, no physical distancing, and we're probably going to see a lot more of this if an election is called. So do you believe that our political leaders should be more careful given the Delta variant? What do you think of that? Thank you for the question. Well, what I can say is that all Canadians, anyone, should recognize the fact that we are not free and clear yet from COVID. We've done good work so far as compared to other countries with regard to our vaccine campaign. 80% of Canadians have already been vaccinated, and it's one of the highest vaccination rates in the world. We are also doing well with regard to second doses, as well as compared to other countries. Not only is vaccination itself a tool in the fight against COVID-19,
le COVID-19 aussi peut-être aussi à cause de le variant préoccupant Delta, que c'est très important.
The Delta variant, as it is still looming, it is still important to continue with public health measures, and individuals have to take precautions.
Au fur et à mesure, toujours en regardant qu'est-ce qui se passe avec
so
l'épidémiologie.
It's really important to read the epidemiology if we need to adjust public health measures. That will be done if there is a resurgence. Now, with regard to anyone's comportment or behavior, well, we're all human beings. It's hard. Everyone is tired. We're exhausted. The last 18 months have been really tough. So it's important to point out that, or rather, it's natural that people might forget themselves, and they might not do what is necessary in terms of physical distancing, but I think that, generally speaking, everybody understands that we still be careful, even if we're doubly vaccinated. I myself, I'm still wearing the mask when I leave the house, even though I've received my 2 doses. So we're talking about another level of personal protection. It's something that's important to point out. There are public awareness campaigns, and so I think for now we're on the right track. It's summer, we're more optimistic, everybody wants to go outside, and as you yourself just said, there's so much to do outside right now, so despite that, we should still be careful. And we should still take necessary measures as individuals. Well, I do understand that every jurisdiction has its own rules, but the leaders themselves travel from one province to the other. What kind of guidelines would you give political leaders who are on the ground? You talked about, or rather, what basic measures should political leaders take? Because not everyone has received 2 doses, not everyone is wearing masks or is physically distancing. So what would you tell political leaders? And to Mr. LeBlanc, shouldn't political leaders set the example for the rest of us? Well, I think everybody can set a good example, including family members. And it's important, yes, for political leaders, but for everyone to be a good example. And this also applies to anyone who's traveling, whether it's from one province to the other. It is nevertheless important to be aware and to know what rules are being applied locally by public health authorities. So it's really important, regardless of where you are in Canada, it's really important to know what is happening locally, what the various jurisdictions are proposing as guidelines. I think everybody understands the 3 C's.
Close spaces, close contact. En français, je dis, faut éviter les becs, les endroits bondés.
So we should avoid very crowded areas, close contacts in confined areas. The 3 C's, they still apply to everyone. And everyone should personally be cautious, wear a mask, and obviously frequent hand washing is still important. And those measures still apply. And everyone should be aware of what should be done wherever they are.
Monsieur Blouin, le Dr. Njoo a très bien répondu à la question.
If I may, Dr. Njoo gave a very good answer to your question. Our government has always done its best to be a good role model. We have always told our colleagues to follow public health guidelines in a province or in a region, especially if you're traveling from one province to the other. I think that the basic precautionary principles, which Dr. Njoo has just explained, and in fact, Dr. Tam and Dr. Njoo from the start of the pandemic have said things that still apply. People should be aware of their obligations, even if they have been fully vaccinated. Nothing is more important than to follow public health guidelines, regardless of where they are. And you could even go farther and take additional measures to protect yourself and those around you. And that is what we are going to keep on striving to do.
Merci, Monsieur le Ministre. Donc,
thank you, Mr. Minister. Béatrice, over to you for the final question.
For the last question.
Merci. Thank you. Our last question, la dernière question, Mackenzie Gray, CTV News. Your line is open. À vous la parole.
Hi there. My question is for Minister LeBlanc. The U.S. has not approved AstraZeneca, and Dr. Fauci has been very clear in the U.S. that people should not mix and match Pfizer and Moderna. Why do you think the Americans would let in people who've received AstraZeneca or mixed and match when they have been very clear that they are not approved either vaccines or strategies in the U.S.?
So, Mackenzie, I'll offer a few comments, and perhaps Dr. Njoo may also want to add something. We recognize that every country has its sovereign responsibility to make the best decisions it can make in the interest of protecting their populations. And we've seen around the world different health authorities recommend or approve different regimes of vaccination that they, in their judgment and in their responsibility, think are appropriate for their citizens or for their populations. In Canada, Health Canada has worked obviously collaboratively with provincial and territorial public health authorities and a body of expert scientists and doctors who have continually provided the best advice possible to the Government of Canada and to Health Canada in its responsibility as a regulator. And we've made the best decisions we can based on the scientific advice that we have that we think are in the best interests of Canadians. Other countries have done the same thing, but there has also been, from the beginning of the pandemic, a very considerable effort amongst countries, certainly European countries, Canada, the United States, other allies, to share scientific information and for Health Canada authorities to talk to their counterparts in the European Medicines Agency and the Food and Drug Administration of the United States. I know Dr. Njoo and Dr. Tam have ongoing conversations with their counterparts in other countries around the world, very much with the idea of developing as much as is possible the right policies that will, at the same time, allow Canadians, or in the case of Americans, the ability to travel and safely visit other countries. But at the same time, we don't purport to tell American health authorities the best way and the best judgment they have in terms of what's the appropriate vaccine regime. But that being said, there are ongoing conversations, and we expect over the coming weeks that advice to evolve with respect to authorities in Europe and potentially in the United States as well. So we'll continue to work with them in a collaborative and transparent way. But at the end of the day, we respect their ability and their right to make decisions in their own jurisdictions, the same way they would respect Canadians' decisions. But Dr. Njoo may have some more updated information on ongoing conversations that have taken place very much since the beginning of the pandemic. So there's nothing new in terms of collaborating with American or European allies in particular. But Dr. Njoo, over to you.
Well, thank you very much. I think you give a very excellent, comprehensive answer, Mr. LeBlanc. There's not really much more to add. What I would just say is that, the evidence continues to grow, right, in terms of the different types of regimes or the vaccines used in different countries. And I think, as they say, the proof's in the pudding, certainly with what we've done in Canada, which was based on some studies, the evidence in terms of the mix and matching. You can see right now what's happening in Canada, with our vaccination approach strategy, the fact that our case numbers are dropping, hospitalization, deaths, and so on. So that's adding to the body of science. And I think, as Minister LeBlanc said, it's a matter of also continue to exchange information between the sort of the scientific authorities of the different countries. And once I think there's sort of a good understanding and everyone being comfortable with what the science and the evidence is showing, that hopefully we can get to a place where we do make it easier for citizens of individual countries to be able to travel to other countries with sort of a more of a common approach. But you're right, there's lots of ongoing discussions and the work continues.
Minister LeBlanc, you said in your response that you're expecting that advice from Europe will evolve in the coming weeks. Right now, in particular, Canadians who got Covishield, the Indian version of AstraZeneca, there's a number of major countries, including the UK, that won't recognize that vaccine. So are you saying that it's your expectation that things will change around Covishield and mixing and matching in the coming weeks with Europe?
Well, I wouldn't want you to extrapolate in terms of a precise circumstance around one particular vaccine. What I think I said, and what I certainly meant to say, is that the ongoing conversations between Health Canada, regulatory authorities, and people like Dr. Njoo and Dr. Tam with their counterparts will, we believe, over time lead to an evolution and an adjustment of some of these measures. They're obviously bilateral but multilateral conversations taking place between Canada and other countries and organizations like the World Health Organization. So we don't expect this to be a static circumstance. And I think over the next number of weeks and months, there may be revisions provided by health authorities around the world with respect to these vaccine regimes, but we don't have precise information on a particular vaccine in a particular country and when those authorities may choose to adjust their particular advice or their particular decisions. But we know that there are ongoing conversations, as I said, both bilaterally between Canada and various countries, but in multilateral fora as well. So we think and believe over the coming weeks and months, some of these situations will likely evolve, and we'll continue to be engaged in those conversations. But like other countries, we'll continue to make decisions and offer advice that we believe is in the best interest of the health and protection of Canadians. And we obviously respect that other countries will want to do the same thing. But if Dr. Njoo has anything additional to add, he obviously can.
No, there's nothing really more to add. Like Mr. LeBlanc answered, the conversation discussions continue as we speak, and like I say, a lot of it has to do with the science and the data that continues to accumulate throughout the world. So I'll leave it at that. Thank you.
Thank you, Dr. Njoo, and thank you, Minister LeBlanc. Donc voilà qui met fin à cette conférence de presse.
This concludes our press conference.
The press conference. Thank you for being with us today. Merci d'avoir été avec nous aujourd'hui. And operator, over to you.
Thank you. Merci. The conference has now ended.